This is a tough disease. This is a disease that when it's advanced, the median survival is a year. This is a very common disease. Most patients are in the late 60s and 70s, so it's an elderly disease, a lot of comorbidities, a lot of bad performance status, a lot of pre-existing conditions related to tobacco. So this is a bad population, elderly and with disease. These individuals are taking a number of drugs, they have heart disease, etc., etc. So that's going to be always the challenge, you know. One of the challenges was to convince our colleagues that tissue is the issue. In other words, that tissue is so important that it's not enough now to have 3 cells and say, has lung cancer, don't ask me more. We have to convince pulmonologists, radiologists that it's worth taking the risk to putting a larger needle to get the tissue. That was a challenge. I think we will win that one. It's just a matter of time. We will succeed. But it's been difficult to ask colleagues to take a risk on a procedure if they don't because they didn't understand really if that was just a hype. You know, these guys are now doing research on this and they want more tissue. I think now they are realizing that actually there's an impact on measuring all these molecular abnormalities in the tissue. I think they are more willing to work as a team and you know, take a higher risk. However, as the technology in measuring these genetic abnormalities improves, I think the needs for tissue are going to go down. In other words, with less tissue, we'll be able to get more information. So that was one of the challenges, the tissue. And the frustrations were, for example, small cell, there's been no progress in 20 years. Squamous, there's not been a drug approved in a long time. And the hope was on the non-smokers adenocarcinomas, where we have found all these small groups of people that respond very well. So that has been like the light that is giving us, boosting the morale, because in the old times being a thoracic oncologist was not necessarily a rosy profession. You know, this was a tough thing to do. So in a way, I think it's good to see that the new generation of thoracic oncologists will be people that are more positive and believers of science, you know.